Hi guys! Today we'll be talking about anemia and its various types. Anemia, anemia to be exact, it is the decrease in amount of red blood cells and hemoglobin in our body's circulation, or in short, loss of cells. What kind of cells? Red blood cells. And it leads to a decrease of oxygen carrying capacity of our red blood cells to the tissues. Now, we can classify anemia according to morphology using the RBC indices and etiology or causes. Under morphology using the RBC indices, we have three. First, the mean cell volume or the MCV, which measures the average volume of an individual's RBC. Next, the mean cell hemoglobin or MCH, which measures the average weight or amount of the hemoglobin in our body circulation. Next, and lastly, the mean cell hemoglobin concentration or MCHC. The normal mean cell volume of a normal red blood cell is 80 femtoliters to 100 femtoliters. For the mean cell hemoglobin, we have 26 picogram to 32 picogram. For the mean cell hemoglobin concentration, we have 32% to 36% in normal value. When this RBC indices decreases or increases, we might have an abnormal RBCs, which doesn't have the capability to transport oxygen or body nutrients in our body, and might be positive with anemia. Now, let's talk about the blood cells abnormalities. Blood cells abnormalities have three types. The anisocytosis, which is an increase in the RBC size, and next is poikilocytosis, which have an increase in RBC in shape, and polychromasia. By the way, polychromasia is just an example of polychromatic erythrocytes, which have an increase in RBC with variation in color. That means it lacks a central pallor and its color. And poikilocytosis, yes, in shape, but these are it is very easy to find when we use a microscope through a manual testing. Now, let's go to the symptoms of anemia. Symptoms of anemia, or people experiencing anemia may experience angina or angina pectoris, hypotension or decreased blood pressure, having a 90/60 blood pressure. Next is dyspnea. Dyspnea or aka dizziness. Palpitations leading to tachycardia, presyncope, and syncope or fainting. Now, let's proceed to the pathophysiology or mechanisms of anemia. If we have a decreased production of red blood cells, or kidney failure, the patient is positive or might have a bone marrow or kidney failure. If a patient have an increased destruction of red blood cells, it means the red blood cells that were produced are premature, leading to bleeding and hemolysis. Now, for the lab test or laboratory test to determine anemia. First, commonly is hematocrit test. Hematocrit test is used to check the packed cell volume of a patient through a micro hematocrit tube. This is what it looks like when we centrifuge a micro hematocrit. The part that being measured for the packed cell volume are this red part. This is the packed cell volume after centrifugation, and this upper yellow part is the plasma, and it is separated by the buffy coat. When measuring this packed cell volume, we only measured the red cells, this red part. And if we measure the red cell including the buffy coat, we'll have an error in reporting the result. And the reference value of hematocrit for male is 40% to 54%, and for female, 35% to 49%. That's all for anemia. Ang ating pag-uusapan ngayon ay tungkol sa iba't ibang uri ng anemia. Simulan natin sa iron deficiency anemia. Ang iron deficiency anemia ay mababang iron supply sa loob ng katawan. Ito ay ang common na anemia sa US. Ito naman ang mga sintomas ng IDA: shortness of breath or dyspnea, fatigue, increased workload of the heart, tachycardia, dizziness, pica, and chylomicronemia, stomatitis, and glossitis. Ito naman ang mga cause ng IDA: chronic blood loss, menorrhagia o malakas na pagme-mens, mababang iron diet, increased growth, impaired absorption. Paano ba nagkakaroon ng iron deficiency anemia ang isang tao? Una, ang protoporphyrin 9 ay magre-react sa iron na galing sa GI tract through a process of ferrochelatase na magproproduce ng heme. Ang heme naman, ang kanya naman trabaho ay magproduce ng hemoglobin. Alam naman natin na ang hemoglobin ay nagbibigay color sa ating RBC. At isa sa mga trabaho niya ay ang mag-transport ng oxygen sa ating katawan. Subalit, kung ang iron naman natin ay bumaba, ang pag-produce naman ng heme ay bababa. At ang ating hemoglobin ay magkakaroon ng mababang resulta kapag ito ay itines. Ang isang paraan para ma-check kung ang isang tao ay merong cell abnormality, ang kanyang MCV or mean cell volume ay titingnan.
Ang mean cell volume ay ang average volume ng RBC na mayroong formula na MCV is equals to hematocrit over RBC count times 100. At ang normal MCV count natin ay 80 to 100 femtoliter. Kapag ang MCV naman ay bumaba, ang tawag dito ay microcyte or microcytic. Kapag tumaas naman, ito ay nagiging macrocytic. Ang IDA ay mas prominent sa children and infants, pregnant women with excessive menstrual flow, elderly with poor diets, malabsorption syndrome, at chronic blood loss. Unahin natin ang infants and children. Ang mga infants and children ay hindi pa sila gaanong fully developed, lalo na ang infants. Most especially, yung mga internal organs nila. Yung pregnant woman naman, mas nagbibigay sila ng iron sa mga baby na dinadala nila. Kasi yung mga baby na dinadala nila ay mas nangangailangan ng iron para mas madali ang pag-develop bago ipanganak. Sa mga woman with excessive menstrual flow naman, mas madami yung nawawalang dugo sa katawan dahil nailalabas through menstrual flow. At yun nga, sa elderly with poor diets, dahil matatanda na sila at mayroon nga silang poor diets, it is dahil hindi na sila kumakain ng maraming pagkain. Medyo mapili na rin sila sa mga pagkain. Sa malabsorption syndrome, dahil may defect ang kanilang absorption capacity or yung siguro sa immune system. And sa chronic blood loss naman, mas matindi ang nawawalang dugo dahil merong internal hemorrhage na nangyayari. Ang mga treatment na maaaring irekomenda sa may taong merong iron deficiency anemia ay magkaroon ng madami pang intake ng iron at treat the underlying contributing causes. Ang mga underlying contributing causes sa iron deficiency anemia ay hookworms, tumors, and ulcers. Ito naman ang mga response ng treatment. In 2 days, ang retics ay makokorek. In 5 to 10 days, magiging normal na ang reticulocyte count. In 2 to 3 weeks, tataas na ang hemoglobin. And in 2 months, magno-normalize na ang level ng blood cells.
Hello there guys, this is a series of anemia. In this previous video, I will introduce normocytic anemia. And always remember, the 3 major causes of this is acute blood loss, underproduction, and overdestruction. As you see here in the picture, acute blood loss is due to automobile or motorcycle accidents. Determines the type of anemia. We have microcytic, normocytic, and macrocytic. Normocytic is between 80 to 100. This will explain what are the causes of normocytic anemia, where the MCV is 80 to 100. You have acute blood loss, underproduction, and overdestruction. So we will talk about the blood loss. Not just the acute one, but also the chronic one. Please remember the fact that IDA or iron deficiency anemia is a cause of underproduction and can lead to normocytic anemia. It can either be acute or chronic and can be variable but has more than 20% blood loss to have like severe symptoms, which is the hypovolemic shock rather than anemia. So here are the causes: the trauma, the motor vehicle accident. Those are the main ones. So let's discuss about hypovolemic shock. So first, you will start losing blood. So it means you will losing blood. Okay. So it means you both losing plasma as well as the RBCs. What will happen is that some fluid will enter in the interstitial fluid, then to replace the plasma, and then you will start to get symptoms of getting anemia. Why is that this is called a dilutional anemia? It's because you're diluting RBCs. You're bringing in plasma without RBCs, so that RBC that are left in the blood vessels are getting diluted like this. Okay. So this is what you call the normocytic anemia. As a response, you will also secrete EPO. Okay, EPO will try to stimulate the bone marrow to produce more RBCs. And of course, reticulocytosis will occur, but it will take time, around 5 to 7 days, until this retix is evident. So this is the first type of blood loss, acute one. This explains about hypovolemic shock and normocytic anemia. Okay, how about the second one, the chronic blood loss? Many causes such as GIT bleeding, such as peptic ulcer disease, colon cancer, piles or aka hemorrhoids. The difference between the two is, and also we have the menorrhagia and metrorrhagia. The difference of the two is that menorrhagia is heavy mens that happen during menstruation, while metrorrhagia is bleeding in between the menses. So metro means inter or menses in between. And of course, cancer. Cancer can also lead into bleeding. So this is iron deficiency anemia. And as you all know, IDA starts at normocytic and eventually became microcytic. So all in all, the meaning of chronic blood loss is iron deficiency anemia, which will start and becomes microcytic. But the big question is how to treat blood loss. This is very complicated topic, but I will explain it more simple and classic. So acute blood loss, you just think the letter A, B, and C, which stands for the airway, the breathing, and the circulation. You have to make sure first that this three is okay. After that, you give oxygen, of course, the IV fluid, and the main one is the blood. We should expect the hematocrit will rise to 30 or above. And how about the chronic blood loss? You just follow the TTT or try to treat the underlying cause. If you have a cancer, a peptic ulcer disease, no matter what you do, you still have a disease. Try to treat the underlying condition first. You can give iron, of course, because there's an IDA. Well, that's it. Blood loss and its relation to anemia. Thanks for watching. Bye-bye.